A Men's Medical Guide. Chapter 1. Men's Health Issues. Men's Health Issues. Most men know less about their bodies than about their cars. Even though testosterone is both the sex and aggression hormone for both men and women, men produce much more of it, usually while they sleep, which is why men are more sexual, violent, wilder, crazier than women, get stressed out, sick more, get injured in accidents, fight more and die 7 years earlier, on average, than women. Women take care of their health better than men. Go to the doctor more, eat healthier foods, drink less alcohol, do less drugs except for the sex drugs and smoke less cigarettes. In general, the lifestyles men lead, particularly with the pressures they put on themselves through their work, predispose them to catch all the major diseases more so than women, namely heart disease, cancer, high blood pressure and stroke. Mental health problems are reported less by men because they keep it to themselves rather than seek out professional help, but their rates of depression and other mental health problems could be as high as that of women and even surpass it in some cases like stress. Overall, men might be bigger and stronger physically than women, but they destroy themselves more through their general lifestyles, injuries through accidents and suicides. Statistics say that women are more mentally unbalanced, but I say men are pretty unbalanced too, they just keep it in more and don't go to seek treatment for it. Books about general men's issues are at number 305.3032, number 306.7081 or HQ28 at the library. Try number 613.04234 or RA 776.5 at the library for books about men's health and well-being. Health issues at the bottom of the page, menstuff.org/mencissus/current.html. Abortion. Ad. Books. ADHD. AIDS/HIV, Elders, Slide Guide, Books. AIDS, Youth, Gender, Elders, Books, Slide Guide, World AIDS Day December. Allergies. Alprostadil. Alternative medicine. Alzheimer's. Andropause. Anemia. Anger, Books, Tantrum Yoga registered trademark. Anorexia, Books, Books. Anxiety, Stress, Fear. Anxiety, Stress. Arthritis. Asperger's syndrome. Assertiveness, Books. Asthma. Autism, Asperger's syndrome. Bacterial vaginosis, toilet seats. Blindness, Books, Resources. Blood disorders. Blue balls. Breast cancer in men, self-exam for men, breast cancer self-exam reminder, implants. Bucket list. Bulimia. Cancer, diet, testicular, breast, prostate, colon, lung, skin. Castration, Books. Celiac disease. Cervical dysplasia, HPV. Chancroid. Chlamydia. Cholesterol. Clustering. Cold/flu, canker sores. Colon cancer. Complementary medicine. Corpus callosum. Crabs. C-section. Cutting. Deafness, Books, Resources. Death, Books. Deep vein thrombosis. Dementia. Dental. Depression, Books, Manic. Diabetes. Diets. Disability. Down syndrome. Drinking. Drugs, methamphetamine. Eating disorders, Resources. Elderly concerns. Emergency contraception. Emotional, Feelings, Books. Ephedra. Epilepsy. Fear, Books, No Fear bumper sticker. Feelings, Books. Fibromyalgia. Flibanseran. Flu. Foreskin. Forgiveness, Books. Gay suicide. Genital herpes. Genital warts. Glaucoma. Glossary of easy to understand medical terms. Gonorrhea. Gout. Grief, Books. Guns and Kids. Health category, directory, screenings. Health tips, monthly. Head injuries without helmets. Heart. Hepatitis A, B, C, D, E. Herpes. HIV/AIDS, slide guide, books. HPV, women, men, myths, genital warts, cervical dysplasia. HR, to establish a federal men's health office. Immunization. Impotency, books, resources, Viagra, books. Infertility. Infidelity, statistics. Inhalants. Joy, books. Kaposi's. Kidney. Kyphosis. Lactation, male. Leprosy. Leukemia. Libido, flibanseran. Loneliness, books. Lumbar puncture. Lungs, smoking. Lupus. Lyme's disease. Lymphoma. Male midwives, nurses, male. Masturbation. Medicare. Meningitis. Menopause. Mental health, resources. Midlife transition, books. Midwives, male, nurses, male. Miscarriage. Molluscum contagiosum, MCV. Mortality. MPD, books. Andropause/Veropause. Non-gonococcal urethritis, NGU. Nurses, male, male midwives. Nutrition. Obesity. Orchiectomy. Organ donor program. Organic. Orgasm, cassettes, audio. Osteoarthritis. Osteoporosis. Panic, books. Parkinson's, books, resources. Penis enlargement. Pelvic inflammatory disease. PEB. Peyronie's disease. Pharmacopoeia. Physical. Poison. Post-exposure prophylaxis. Prostate, directory, books, slide guide, booklet and videos. Prostate Cancer Awareness Week, SEP. Prostate Checkup Reminder. Psychological, news bites, books. PTSD, resources, books. Prozac. Pylori stenosis. Recovery, books, resources. Relationship. Ritalin, books. Reparative therapy. Rural health, resources. Safer sex. Sarcoidosis. SARS, severe acute respiratory syndrome semen. Scabies. Self-injury. Senior health. Severe acute respiratory syndrome, SARS. Sex, teens. Sexual, books. Shame, books. Sick school syndrome. Skin problems. Sleep disorders, sleep apnea, sleep sex. Smoking, second-hand smoke, the Great American Smokeout. Spinal tap. STDs, slide guide and resources. Stress, books, resources, happy holy days. Suicide, emergency numbers, books, teen, gay, elder. Suicide, teens and guns. Syphilis. Tattoo removal. Teen suicide. Teens, suicides and guns. Teen concerns, sex. Teeth. Testicles, directory, books, resources, self-exam, in Spanish. Testicular cancer. Testicular Cancer Awareness Week campaign, Get a Grip. April. Testicular self-exam reminder. Testosterone, books. Test. Tetanus. And therapy, reparative, news bites, books, ex-gay. Therapy, books. Transition, books. Trichomoniasis. Uric acid crystals. Vaccines. Vaginitis. Vasectomy. Viagra, books. Viropause. Warts. Water births. Weight loss. Workout tips. Books. Yeast infection. Chapter 2. Some men's medical topics. Gynecomastia/breasts in men. Men can get breast cancer, so if you feel a lump or feel pain, don't be above getting a mammography. Gynecomastia is an abnormal enlargement of the breasts of a male, generally resulting from too much of the female sex hormone estrogen. It could occur temporarily in newborns from the hormones his mother is passing on to him, and at puberty along with other hormonal changes. Gynecomastia is common in men with Klinefelter's syndrome. Gynecomastia could be the result of a tumor in either the testes or the breasts, which trigger an excessive release of hormones. There is a link between gynecomastia and cirrhosis of the liver, so if you have one of these conditions, check for the other. If your breasts are too big, generally from being obese, you can get them surgically reduced by a plastic/cosmetic surgeon. Interact.withus.com/interact/mbc, male breast cancer. samiscloset.com/gynecomastia. bariatric-surgery-male-breast-reduction-gynecomastia.htm. Male breast reduction info. Men get breast reduction if their breasts get big from being overweight or genetics. bariatric-surgery-male-breast-reduction-gynecomastia.htm. Chlamydia in men. Chlamydial infections, the most common STD, are caused by the bacteria Chlamydia trachomatis. In men, it causes infection in the urethra and epididymis. It is not usually detected until in an advanced state. Some urine tests can now detect its presence. Chlamydia is a very harmful bacteria that manifests itself in flu-like symptoms and could lead to blindness, pneumonia, eye infections, and infections in the urinary tract. In men, the infection happens in the urethra, which is the pee hole that carries urine from the bladder to the tip of the penis for release out of the body. The Chlamydia trachomatis organism is usually passed from one person to another during sexual intercourse or any other type of intimate contact. The man will probably find out he has it by feeling constant pain and inflammation in his urethra/pee hole area. This infection could spread to other parts of the body like the rectum and the throat and cause pain in these areas. You can also get chlamydia from anal sex. If your rectum hurts and you feel like you are using the bathroom more than usual, you could have chlamydia. Use safer sex practices like use a condom and try to stick with one partner rather than multiple partners. If your urine looks watery or discolored or you feel pain while urinating, go to your doctor. He will either take a swab of your discharge or a swab from the inside of the urethra, rectum, or the throat, then get it tested for content. If left untreated, chlamydia can cause acute epididymitis and inflammation of the penis area. Oral antibiotics usually cures the infection. Some commonly used antibiotics are azithromycin, doxycycline, ofloxacin, sulfasalazole, and erythromycin. It's a good idea to get screened for chlamydia every year, and anytime you have new lover, you should get a general comprehensive STD test, including an HIV test. Human growth hormone/HGH. Human growth hormones have been officially used to help children with stunted growth grow. It is a natural substance produced in the pituitary gland in the brain. HGHs have been touted as the fountain of youth, if you can afford them, but some people say there are too many side effects and others say they're just hype. Anabolic steroids and human growth hormones have the same effect. If you really want them, you can go to Mexico/Puerto Rico and buy them over the counter at most drugstores, or get a prescription here from an anti-aging/longevity/wellness doctor. Anybody can claim to sell human growth hormone over the internet. You could be outright scammed, not be sent anything, or get a bottle of useless crap. If you really want HGH, there are doctors around now starting up all kinds of practices called something like an anti-aging clinic or longevity clinic, where for several $100s per month, they'll give you HGH shots or write you the prescription and you can inject it yourself. I saw one in Vegas. There are lots of what they call natural HGH releasers, which are supplements that supposedly help your body produce HGH naturally. Your guess is as good as mine as to whether this stuff really works. It's the money factor. These HGH releaser supplements can get very expensive. I wouldn't waste my money. If I was rich, I'd buy the real thing on a Caribbean island, use it for a few months, and if it worked, I'd go on cycles, use it for a while, go off, use it for a while, go off, etc. growth-hormones.info en.wikipedia.org/wiki/human_growth_hormone Jock itch/tinea cruris/groin dermatophytosis. Jock itch is the common term for the fungal infection of the genital area, which is called tinea cruris by the medical community. It is also called ringworm of the groin and fungal groin infection. Jock itch is caused by fungi called dermatophytes. It is aggravated by friction and moisture. For the most part, this is a male disease, but women, particularly athletic ones who sweat a lot, can get it too. The most common treatments are to clean all clothing and athletic equipment that goes near that area regularly. If some article of clothing rubs against you, get rid of it, use something looser. Apply foot powder or baby powder to the area to help keep it dry. Clean yourself regularly. Take showers. Wear loose-fitting clothing and cotton underwear to give the genitals a chance to dry. Don't use other people's clothes or towels. There are over-the-counter and prescription fungal treatments. Topical antifungals are a common treatment. If it gets serious, the doctor will prescribe oral antibiotics. Yeast infection is a related condition that girls often get. If you go to the doctor, he or she may take a scraping and examine it under a microscope in order to make a diagnosis. en.wikipedia.org/wiki/jock_itch en.wikipedia.org/wiki/tinea_cruris webmd.com/skin-problems-and-treatments/jock-itch Men's plumbing issues. Pain in the penis could be caused by several things. Don't be embarrassed about going to a urologist to check it out. It could be infections, skin problems, urethra, pee hole, or prostate problems, allergic reaction to soap, lubricants, clothing, chemical your lover uses in her vagina, Peyronie's disease, use of sex toys, cock rings, vacuum device or other penile devices, a hernia, testicular problems, etc. If you urinate often and in sizable amounts, even if you don't drink many fluids, you could have diabetes, an enlarged prostate or an STD. If you urinate often but in small amounts, it's probably an enlarged prostate. If your urination is painful, you could have an STD or prostatitis. Most of men's problems in the penis aside from prostate or testicular cancer are swelling, usually due to a fluid buildup caused by any of a number of reasons. In the testes, it's called orchitis, in the shaft, balanitis. Wait for a few days. If it doesn't go down, go to a urologist. Phimosis is a condition where you're born with a foreskin that's too tight and can't be drawn back. Men can get cancer of the penis and cancer of the scrotal skin, although rare. A good defense is to stay clean down there and don't lay a cell phone down there nor sit too close to microwave devices because of the link with cancer. Smoking is also heavily linked to cancer, particularly lung cancer. Many men who either masturbate or screw a lot, get irritations on their penises like scrapes or mild scratches, and for uncircumcised men, if they pull too tight, the foreskin can split, causing cuts at the tip. The penis is so sensitive that it hurts very badly. The solution is to use lubricants and don't do it so hard. Male dyspareunia is painful intercourse. It can be caused by many things: keeping a hard-on too long without ejaculating, the cock coming in contact with chemicals, allergies to something, mental blocks, STDs, etc. If your cock hurts for longer than a few days, you should go to a urologist. A penile fracture happens when you screw too hard and hit a woman's pelvic bone or something like that. Blood vessels break and the penis swells and turns blue. It could be that a penile ligament breaks. Go to the hospital or a urology doctor if it happens. If the cock bends suddenly while having sex, it could hurt and cause a break in some blood vessels. Peyronie's disease is a condition whereby calcium deposits build up in the penis where it has been bent. Be careful of unusual positions. Cordy is the condition of a curved, painful erection of the penis. It happens when the urethra/pee hole is shorter than the shaft, which makes it bend, especially when it's hard. Some boys are born with this. It can be corrected by surgically lengthening the urethra. A penis fracture happens when you hit the penis either against the woman's pubic bone when you make love or hit it against some other object. There's pain and swelling. One of the large blood vessels, the corpora cavernosa, has broken. This condition can be fixed surgically. Balanitis xerotica obliterans is a male condition characterized by the shrinking of the glans, tip of the penis. It could be caused by either a skin disorder or an STD. If it doesn't go away in due time, go see a doctor. Epididymitis is an infection of the epididymis, the tube which goes from the testicle to the penis. Tuberculosis could cause it as well as other things. Treatment is antibiotics. Hematospermia is the presence of blood in the sperm ejaculate. It was been linked to a number of causes from a number of places. It could be serious or harmless. Get it checked out by a doctor. Hypospadias is a condition where a baby boy is born with a urethra that is not developed fully to the tip such that the urine comes out of the side of the penis shaft. It can be corrected by surgery. Paraphimosis is a painful condition where a retracted foreskin is too tight and acts like a tourniquet on a penis, especially during an erection. It is one of the few justifiable reasons to get a circumcision. Phimosis is a condition in which a too tight foreskin cannot be fully drawn back over the head, or glands of the penis, which impedes the free flow of urination. This is one of the arguments put forth supporting circumcision. Alcohol usage in men could decrease testosterone production, which could reduce sperm production and feminize the breasts somewhat. Men can get breast cancer. Check your breasts out for lumps. Bike riding can adversely damage the penile area. Try to get a soft seat or bike less. Penis cancer is quite rare, but when it happens, expect some of the penis to be removed and death in 25% of all cases. To protect yourself, keep your penis clean. If you're uncircumcised, you're more likely to get it because the foreskin traps bacteria, but you just have to wash that area more. Blue balls, a slang term for the inability to come to orgasm after being sexually stimulated. Balanitis is an inflammation of the head area of the penis that could be caused by infection, STD, irritations, etc. It can be treated with antibiotics if it's caused by an infection, but other than refrain from sex to see if it heals. Satyriasis is the male version of nymphomania, named after satyrs, the attendants of Bacchus, the party god who were one half goat, one half man, known for their debauchery and decadence. Spermatocele is a swelling in the epididymis, the are behind the testes where sperm is stored after the testicles produce it. This condition could lead to temporary or permanent infertility. Surgery can correct the problem in some cases. Pelvic pain info. Pelvic pain in the lower abdomen/groin area of men could be caused by several things. The intensity of the pain could range from mild to severe, intense pain. It could be acute, coming on suddenly, or chronic, lasting for a long time. Depending on the malady, there could be other symptoms like fever, fatigue, nausea, vomiting and problems urinating. Some of the possible causes of pelvic pain in men are as follows: acute prostatitis, appendicitis, colon cancer, diverticulosis, small sacs form in the walls of the intestines, epididymitis, gastroenteritis, infection in the digestive tract, hernia, infection of the urethra, irritable bowel syndrome, kidney problems, musculoskeletal disorders, pelvic adhesions, peritonitis, an inflammation of the lining of the abdominal cavity, prostate infection, sexually transmitted diseases, stress, testicular torsion, unknown cause, urinary tract infection. If you feel either an intense pain or a prolonged pain in your pelvic area, it could be serious, so go see a doctor who will run tests such as a urinalysis, a complete blood count/CBC and X-ray imaging such as ultrasound, CT scan or MRI scan. Treatment could range from antibiotics to surgery. Sperm count info. Sperm are quite small and only make up about 3% of the ejaculated fluid, the other 97% being a fluid manufactured by the prostate gland which shoots out behind the sperm and pushes it into the vagina. The mixture is called semen. The sperm, little living cells, contain your genetic code, and when ejaculated, they have a mind of their own and try to swim upstream through the vagina into the cervix. There are many reasons why a man could have a low sperm count, ranging from genetics to pollution to stress to alcohol to certain medications. You can get sperm count tests done. To do a sperm count, a male goes to a lab, masturbates, and ejaculates into a test tube. A lab tech examines this ejaculate immediately under a microscope to count the number of sperm, to check the sperm's motility and to see whether it is normal or abnormal in some way, like having 2 heads or 2 tails. The standard of infertility is under 60 million sperm per ejaculation. Even though it just takes 1 sperm for conception, you need 20 million sperm per milliliter of ejaculate to fertilize 1 ovum. Because so many are killed by vaginal and uterine substances, then it takes more sperm to kill off these enemy substances, making room for the last few sperm to come in and fertilize the egg. The testicles produce sperm. For maximum production, they must be 5 degrees cooler than the rest of the body. In order to keep the testicles cool, don't wear tight underwear, avoid long stays in a hot tub or sauna, and take care of your health. Generally, the larger they are, the more sperm they produce. The average man supposedly produces 50,000 sperm per minute, 3 million per hour, and for every ejaculation, he shoots off 300 to 500 million sperm, which doesn't seem to make sense mathematically if you are shooting off several missiles a day. When sperm are released into the vagina, many are killed by the vagina's acidy fluids. The rest try to swim into the uterus to attach to an egg, but very few ever make it. It could be the girl's problem. Even if you only produce a few sperm cells, that could be enough provided the other conditions are right. Maybe she's infertile for some reason. The sperm that spot the egg engage in a fierce battle to get into it. They let out a chemical which penetrates the wall of the egg and try to get in. There can only be one winner. The one that breaks through first unites with the 23 chromosomes of the girl's egg. Even if you are impotent, doctors can go into your testicles and extract some sperm to implant artificially into a female egg. Infertility could be caused by a sexually transmitted disease which could damage something in the penis, like the vas, the little tube that goes from the testicles to the urethra. Clomid is a drug that increases sperm count.